Okay, Dr. Kate,
Hello.
thank you so much for coming on my podcast. I put out a poll on the old Instagram about guests that people would like to hear from, and you were mentioned a multitude of times.
Oh,
I know.
I feel so
Yes.
honored.
Yes. So I feel like your approach to sex is both, I don't want to say clinical, but like it's applicable from like a psychological standpoint as well as the actual, you know, interesting and more like humanistic aspects of sex, which I feel like it can sway from one direction to the other otherwise with like either like wild information and like it doesn't feel like anyone who's not in the world of sex can use,
Mhm.
or super psychological and then somewhat sterile.
Or
So,
dry.
and dry. And
Yeah.
nobody wants to be dry when
Mm.
dealing with the topic of sex.
No,
That
that is
was
not
my
comfortable.
first no, it's not comfortable in any way, shape, or form. First dad joke of the podcast. Got it over with at the beginning. um, so the reason why I think it's so important to get your take, and I have many questions, mostly from myself, about how to bring the sexy back into intercourse or timed intercourse
Mhm.
when dealing with sex from a fertility standpoint.
Okay.
Um, and I'm wondering, do you see a lot of like in person clients that are dealing with infertility, or is this sort of like a new space?
No, I have worked with people who are at so many different stages of their pregnancy journey, including surprise pregnancies, planned pregnancies, pregnancy loss, infertility, IVF, and sort of everything in between. And then, of course, postpartum life and adapting to motherhood or parenthood, and trying to reclaim or reconstruct an identity. So the gamut is wide and expansive. And I've worked with folks pretty much on every point in the journey. And I'll say in my own friend circles, most of us are in our 40s now. So there are a lot of conversations about infertility and pregnancy, and kind of where some of my friends are right now who are longing to have a baby and maybe for the first time feel ready in their lives, but aren't having the ease in which they might have hoped because of their age and where they are in life. So it's loud in my life.
Right. That's so interesting. My last guest that I just interviewed, Dr. Amy, she's also on the West Coast.
Mhm.
And she was saying that she believes that in the future, most of motherhood will start in the 40s and like into your 50s, because that's when women feel the most ready to begin that journey because they've been so focused on things like constructing an identity or careers, for example. I love that you said reconstructing an identity, because I would never have even thought about that from like the standpoint of an individual and infertility, both infertility and infertility. Um,
Mhm.
can you expand on that?
Yeah, of course. I think for a lot of people, how cooperative their bodies are in the process of becoming pregnant and being pregnant and giving birth can have a really big impact on how they view themselves and the identities that they hold. For many people, struggling in the fertility process has been overcoupled with a sense of worthiness, or overcoupled with a confirmation or a contrast to how they want to see themselves, especially in their gender identity. So I think there can be a lot of difficulties that come with however your pregnancy journey takes shape and form. It can challenge who you think you are and who you think you want to be. And it can actually create really beautiful openings into a new identity that it takes into consideration the experiences that you've had and that are now assimilated into how you see yourself and how you interact in the world. I think we have sort of a magical fantasy about getting pregnant a lot of the time when we're young. And so for some folks, it's really easy and it happens in pretty much the way they might want it to. And for a lot of folks, it just isn't that easy. And so people have a hard time and they get really unfortunate feedback from other folks who probably are undereducated about how difficult pregnancy can be. So I think it's an interesting obliteration for a lot of people and a really beautiful kind of reconstruction or reconstitution that often leaves the folks I've worked with feeling even more confident in who they are, but it can be really painful getting there. But on the flip side, also becoming a parent, especially becoming a mother, can also be really identity shattering because now there's this new label and there's all of this pressure from society on what it means to be a parent, especially what it means to be a mother. And are you a good enough mother? And are you doing things the right way, whatever that means? There's just lots of opinions foisted upon mothers and not a lot of real support. So I think that a lot of the women that I've worked with really struggle with how to reconcile the woman and the human they have been with this new identity as a mother, which is, really something they may have wanted or maybe not, but they're sort of curious on how do I make sense of how I see myself and how other people now see me. And I'm juggling all the responsibilities of taking care of this small human. So there's just a lot of metamorphosis happening, I think, at that time for folks as they're having their pregnancy and birthing journeys.
It's interesting because part of my intake form, there's a section where it goes through libido and how
Mhm.
important that is. Because in Chinese medicine, if you have a good libido, it's seen as you've got good movement of qi. So, like your liver qi stagnation pattern is not presenting in a patient where they have like a healthy libido. Obviously, like too much of a libido is also an issue. Too little is an issue. So you want to be sort of in between, which is for any given person, it's sort of like a very arbitrary amount. But it's interesting to me, at least, when I'm looking at these forms, people are either one or the other. They feel like they either have no libido or their libido is excessive and they are judging themselves against their partner.
Mm.
And for myself, I know I've completely taken the libido and the sex aspect of fertility and like thrown it out the window. I don't even remember what my life was like before this sort of took over.
Mhm.
Um, and it's probably because of a career focus, but it's also, I think, because of how much I am dealing with sex on a day to day basis without actually dealing with sex.
I think that could play a huge role. That for a lot of us who work in the sex space, when it becomes our profession, it's an interesting renegotiation in our personal lives. And
Right.
I find that I have to be a lot more stimulated before I'm even interested in being sexual nowadays too. And I think in part it's my age and hormones. And in part, it's that same as you. I talk about sex pretty much all day, every day. And sometimes I just want to not think about it.
Do people think that you are like a wild cat on account of this being your career?
That is often the projection that gets thrown at me. Yeah.
Right. Like your friends, but do they ask you for advice of this sort of thing?
Sometimes, yeah. I mean, my friends and I, we've got such a lovely group. We're pretty open about sex anyway, and all of us have our own kinks and preferences, and we all talk about it pretty readily. But it's interesting that a lot of men project that on me, and have a lot of opinions about how they might be able to help me satisfy some itch that they believe I have, which is always really entertaining and annoying.
That I like was fun. I didn't even know how to respond to that. What do they say they can fix or satisfy?
Oh, I don't even know how much time we have to go into all of that, but they have a lot of ideas about what it means to be a sex therapist. And I think a lot of folks have a lot of misconceptions about it.
Yes.
And for a lot of men, not all men, of course, but for a lot of men, I think they hear the words sex and therapist and they hear, I'm going to be taken care of. So they get excited and they go into this headspace of, does this person have sex with their clients? Which, of course, the answer is no. But that is a misconception that a lot of people, more men than anyone else, have about sex therapists. So it's a question that comes up, and they often want to, I think, get accolades, much like a young student might want to bring their teacher an apple and be favored by her. I think there's a little bit of that mommy transference or, teacher transference. They want to be the one who gets the prize or can flip the teacher in some way. So, it's part of their organization, their psychological organization, but that's not something sex therapists do. So they're always quite deflated when they learn it's not an option.
Oh my God. I can't even imagine having to have that conversation. You're pretty calm. I feel like you would calmly drink your water like this and then tell them that this is in fact the case, and then they would just shrivel up and that would be the end of it.
Yeah, it's a livelier conversation when it happens at happy hour, but definitely in session, it's an interesting conversation, and I think um, I'm not the only sex therapist who gets these questions and has this transference coming at them. This is very common, so it becomes a really, I think, important and interesting point of exploration, right? Like, what do you get from that fantasy? Should it have been a reality? What is interesting about that for you, and how does that idea factor into your everyday relationships or not, right? We can look at it as a point of curiosity.
When people come to see you, how frequently are you getting patients who are in the midst of a fertility journey?
I would say probably at any given point on my caseload, like probably 10 to 20% of the folks I'm working with are in that space. I have a handful of specialties that I work with. So this is definitely something that's pretty common for our practice. And we, we really love the work because it is an intense journey for many people. And it feels like a huge honor to be a part of that with them and to hold space for them. Because to your point, a lot of women lose themselves in the process and they don't often have a ton of support.
Right. I also feel like it's socially acceptable to just, once you're done having kids, do somewhat what I've done, which is like, okay, well, this is now reserved for your birthday and the weekend because I'm tired and I'd rather watch a sitcom. Like, and
Yeah.
it's not a reflection at all on my partner. It's more just that I have no interest in getting myself in any type of situation where I'm off of the couch and am having to make another effort. Do you know what I mean?
Oh, I do. I feel it in my bones, and I don't even have kids. It's a lot, I think, and it's also really natural. It's natural for people to have a relationship with desire and a relationship with sex that ebbs and flows. And we do have different seasons in our lives where sex is perhaps more important to us, and other seasons where work is more important, or parenting is more important, or taking care of other family members is more important, or traveling, whatever it might be. Um, Not having a lot of sex does not have to mean anything is wrong with you or with your partner or with your relationship, right? I think we need to give ourselves and our partners a lot of grace to have a fluctuating and authentic relationship with desire.
When it's been turned from desire to like an outcome, like with fertility, for example, is like, are you finding it's the sort of the same couple, like in terms of like a type, or is it like different scenarios, different problems, different fatigues?
Yeah, I think in the work that I've done with couples around this, I think there's a few patterns that emerge. And of course, everyone has their own journey. So if this does not reflect a particular listener's journey, it doesn't mean their journey is bad or wrong. Um, but I see typically couples at the start of the process trying to get pregnant. They're really excited about it. So sex comes pretty easily to them, maybe for the first handful of months. And then if they're not pregnant at that point, it starts to create some anxiety. And there might be more pressure on trying to be sexual at certain times during a cycle to help align with the peak fertility moments. And that can start to create a little bit of a feeling of obligation, which, obligation and desire are often mutual enemies, right? They just don't get along. So the more something feels like a task or an obligation, or like someone else feels entitled to it, it's like, ugh, right? And it can make it even more difficult for couples to align, even though they might love each other, they might even mentally desire each other, but their bodies just may have a different reaction to the scheduling of it all, or the outcome, oriented approach that is sometimes necessary if you're trying to get pregnant.
Right. That was really interesting what you said about the obligation piece. And if you feel as though you're obligated to have sex, all of a sudden you're like, I don't wish to do this ever again. And I feel like that's mostly, I find myself frequently saying to patients, I am your husband, because they're like, he just doesn't want to now that I actually need him to do this. And although it's no longer a fertility thing for me and my husband, I'm very much like, but a certain amount of time, I'm like obligated to do this. So now I must do this. And so I find myself regularly telling patients, like, it's not because he doesn't love you. I am your husband. I like just doesn't want to be like a necessary task, because then it removes any sense of like sexy, if you will.
It can also be a conflict avoidance strategy for a lot of husbands. They really want to see their wives or their partners happy, pregnant, thriving. And the fear and the anxiety that can come with, what if we have sex again this month and it doesn't happen again? I can't stand to see her heartbroken.
Right.
So there are a lot of men who kind of freeze and they don't know how to show up for their partners. And that manifests in this avoidance of sex too. So it can be lots of different variables that can complicate someone's or a couple's pregnancy journey together, right?
Right.
Yeah.
Like they're trying to mitigate failure by
Yeah.
not trying. So they're sabotaging themselves.
Well, I might say they're trying to protect themselves psychologically,
Right.
but yes, it ends up not reaching the goal they want, which is an absence of conflict.
Right. I have that conversation frequently with my female patients where they'll find every reason to avoid having sex during their fertile window. So they're coming to see me for fertility acupuncture. They are being cycle monitored at the clinic, and then they'll miss the window for like some strange reason. And it like things that could be overcome. Like scheduling like a yoga class that could definitely be avoided, and then feeling too tired after said yoga class. And at first I was really, I couldn't understand why anyone would want to do that when they were trying so hard otherwise. And then I forget, I think it was one of my patients who's a therapist. And she said, well, if you don't put in 100%, you can always say that the reason it didn't happen is because you didn't give 100%, as opposed to dealing with the actual issue of maybe there are other things that we need to overcome and not wanting to look at that reality. So that can happen from like a male perspective as well in
Mhm.
sex avoidance, in conflict avoidance. Whoa, Dr. Kate, you just blew my mind. Yes, I've that's really interesting. I have in 2 instances in the last 2 weeks had 2 patients come in and tell me that their partner couldn't perform,
Mhm.
like they couldn't
Couldn't have an
you
erection.
couldn't have an erection. I was gonna say something vile. I'm happy that you changed it to a more technical term.
Your podcast.
Um,
Let it go.
no, I would much rather have said have an erection, but I couldn't. I don't know what's wrong with me. I couldn't muster it. Similar to them. And so they similar
It's your second dad joke of the day.
that's my second dad joke of the day. But they couldn't manage. And so in that instance, and they any other time of the month they could.
Mhm.
So it's not necessarily like a hormonal issue, but
Mhm.
rather potentially conflict avoidance.
Totally. I love penises, honestly. They're such communicative
Wow,
little buggers. Maybe not so little, maybe I don't know. That's a bad pun,
I like
but
it.
they tell us a lot, right, about the human attached to them. And in instances where someone is having a difficult time getting an erection, it is often related to a fear of like what happens if I try and it doesn't work? Am I less of a man? Do my sperm not have what it takes? Am I going to fail my partner? Is she going to be angry at me? There can be some big abandonment fears and all of that. And they
Right.
can also start to feel like their partner is very entitled to their erections or to their sperm. If their partner is starting to feel more desperate in her fertility journey, and panicky. Um, I've worked with many men who start to feel like, gosh, I don't even know if my wife loves me anymore. She's so baby crazy that I feel like I'm a prop for her. And so it could be a question of, are they feeling objectified and are they feeling used, or are they feeling like they're a part of the process as well?
Right. What else
Yeah.
can penises tell us aside from I'm just curious now. Like, are there other things that you use them as a barometer for? I use periods all the time as a barometer for overall health. So I
Yeah,
like this
I
this
think
idea.
penises are a great barometer for overall health and especially for mental health. I mean, when there's anxiety or depression or trauma, often penises will have a lot to say about that. They may have someone who has a penis may have a difficult time getting an erection, or they may conversely have more desire and more arousal. So they might kind of be at one end of the extreme or the other. Usually, and that happens for people with vulvas too, right? Desire can be amplified or reduced when there's anxiety or trauma that someone's working through. So our genitals are really beautiful and so important to who we are.
Yeah. I mean, I mostly forget about mine most of the time. I actually feel like for somebody who deals with reproduction every day, I don't even think about the genitals. I almost skip over them entirely. We're immaculate conceptioning at this point. Like just ovaries, uterus, and sperm. And that's my trifecta of what's going on. This is very illuminating. We're like going back to the basics of what teenagers think sex ed is, which is pretty much just penises and vulvas, and they don't realize what happens above,
Right.
which can sometimes prove problematic.
We're problematic.
Yes. Um,
Gestures around globally at our political system. Yeah.
oh my gosh. Yes,
It's
especially
super
in the
problematic.
States. Yes.
Yes.
Um, what strategies do you use when clients or patients come in to see you to help them, bring back desire? Like, I always hate when people ask me these generalized questions that don't apply to all groups. But if you had advice for how to reinvigorate like
Mm.
sex life that has now become about obligation, or about, making this fertility journey successful, like what would that be?
I would say a couple of things. One, try to have more sex. Now, that might sound like the last thing you want to do, but try to have more sex by yourself so that it's just about your pleasure and you're staying connected with the experience of pleasure without it needing to be a performative or a goal oriented experience. And same with your partner. Try to ensure that you're having sexual experiences that are really fun and don't have anything to do with getting pregnant. Also, I think it's important to mitigate anxiety and rumination and obsession, which can happen a lot when you really want something and it's not happening as quickly as you want it. So, I work with a lot of folks on reducing anxiety and helping them regulate their nervous systems more. In addition to other kinds of things like identifying what support you do and do not have, leaning into the support you do have, and trying to build up where you don't have support because pregnancy journeys can be incredibly lonely and isolative for people. And the more you can connect with other folks in general, but especially around this issue, it can really help get you through some of those hard days, especially if you're prone to high anxiety or obsession or rumination. The other thing I recommend is that to the best of your ability, have a lot of other hobbies and things that you do so that your life stays full and interesting. Because if you make getting pregnant your only activity, your only thing, then of course it's going to feel larger than life and it can amplify the likelihood that you become more fixated on it, and the more anxiety and distress that you feel around it, the more difficult it's going to be to one, have sex you enjoy, but two, really enjoy the process, whatever your process might be.
Yeah.
um, and the last thing I would say is, if this has been a struggle, please do not underestimate your mental health. Really working with a therapist who is informed about the pregnancy journey can be really important, because having that support and having a care team that has your back when other people in your life maybe don't get what you're going through or have their own agenda or their own timeline for you, I think it's really important to make sure that you can really take an exhale. Because I just know so many women who have gone through this journey on their own, and it's made them tough in ways they wish they never would have had to be tough, right?
Right.
And especially in American culture, we just do not support mothers well enough, and it's a really hard place to feel alone.
Do you support a lot of women in their postpartum journey in terms of like bringing sex back to their relationship?
Absolutely. Yeah, absolutely. I think it's a big part of reclaiming their personhood when they feel ready for it. But it also can be a huge source of conflict in a relationship, because as much as I think men have evolved, there still are a lot of men who really do not get the toll that it takes on a body to be pregnant and to give birth, and the healing that happens from that. And I know medically, a lot of doctors recommend 6 weeks until you have sex again. But in my experience working with women and pregnant people, the majority of them say things like, you know, if I don't have sex again for 6 months, that'll be too soon. Or I didn't want to have sex for the first year after having a baby. Or I was so touched out and resentful of my partner for demanding that we have sex. So I work with a lot of couples on recalibrating expectations and really helping moms create boundaries for themselves that allow them to feel like themselves and not capitulate to this expectation of sex in order to prove something about their relationship health. And I work with their partners to really mitigate what is going on that's driving their rush of the process. And I try to help the couple find different solutions so that they can meet each other a little bit more in the middle without the person who's just had the baby having to be sexual in a way that really doesn't feel good for them. Because if couples start getting into that habit of obligatory sex just because they're trying to keep the peace, or my husband claims he has blue balls, which nobody died from blue balls, so he can probably handle it himself. But I hear a lot of women like kind of availing their bodies to their partner's demands. And it really, really messes with their dynamic and their desire together for a long time moving forward. Because the more entitlement that people feel someone else having toward their body, the quicker their desire decreases. There is an inverse relationship between entitlement and desire. So that's a dicey place for couples to be, because often sex is a place where they've communicated a lot of their care for one another. So yeah, I work a lot with couples in trying to find a cadence and some expansive options that really respect each of their needs.
Do the male partners, are they receptive to your like explaining the need for not a break, but like for the female partner to sort of decide when she's ready to come back to that type of a relationship? Or are they pushing back and making, suggestions or demands or
It totally depends on how much they adhere to the ideology of either benevolent sexism or hostile sexism. I find that partners who are less adherent to any sexist ideas tend to be more patient with their partners. They tend to be more respectful of their boundaries. They tend to be more humanizing of the process and better caretakers of their partner as she's healing. Um, for men who have a higher adherence to ideas of benevolent sexism, they also can be pretty patient because there's such an idealization of the mother. And sometimes it actually can result in them desexualizing their partners and sort of seeing her as now she's a mom. So I can't really bring all of that sexual libido to her. I don't think it's conscious all the time. In fact, most of the time it's a very unconscious process. But for a lot of men who do have that sort of ideology, it can take them some time to really like want to be sexual with their partner again. But the men who have a higher adherence to ideas of hostile sexism are usually pretty sexually entitled. They don't like hearing the word no, and they typically will be they would be more likely to engage in boundary pushing or guilting their partner and engaging in sort of these subtle acts of coercion to move her along in her process at a pace that feels better to him. So, how do they hear my feedback? It depends on kind of where they are in their own level of respect for women.
that was a great answer. That
Mhm.
was very interesting. What do you do when, let's say you had a male partner who had now saw their partner mostly as a mother and desexualized her, and it doesn't come back? Like
Yeah.
what happens then?
So it's a great question. Sometimes partners can get that back. Um, it depends on it really depends on psychologically what's the origin of that desexualization. So if it is related to kind of seeing mothers as non-sexual beings, a man doing his own work in individual therapy can sometimes work through that. Some men have had trauma with their mothers, and so when their partner becomes a mom, they start to see her as a mom because, newsflash, we all see our partners as sort of envisions of our earlier caregivers. We project our stuff onto them.
Right.
So when that happens, sometimes resolving the underlying trauma or fears can be a great way for him to be able to bring that libido back into the relationship. Um, Sometimes it's a question of, their motivations have changed, and or he's trying to protect her and doesn't want to hurt her. And so we can do things to help them really communicate on what their limits are now, and that can be useful. But sometimes it's about making sure that they still see each other as humans first and parents second. And that usually requires introducing more independent time and making sure that mom has enough time to go out and be a human and a woman and to take care of herself and to be vibrant in her own right, in her own being. And for him to see her less as a mom and more as the woman that she was once before. And vice versa, right? A lot of times this happens for women when they see their partners. They start to see him as a dad. And look, when you get in a long-term relationship, you kind of habituate to each other anyway. So it's really easy to start seeing your partner as something that blends in with the wallpaper. So if you're not like
Yes.
yeah, if you're not creating some zhuzh, right? Some novelty, some spark, some space psychologically and sometimes proximally, it can be really hard to get over that hump of seeing your partner as family or part of like your home domestic life, which often isn't sexy, right? So like go out, do things with your friends, get your own hobbies, plan activities that really hone in on your lives together as adult sexual beings and try to do things at home so that you're seeing each other as humans at home, but you can't not do parenting things, but maybe your male partner needs to take on more of the parenting share too. I think this happens more in couples where there is a disproportionate amount of domestic labor and emotional labor that their female partner does. The male partner often sees her as so domestic that it's hard for him to see her as a sexual being. So, helping and chipping in and doing, not even helping because you live there, you should be doing those things anyway, right? But
Right.
making sure that there is equity in the domestic labor, the care tasks, the emotional labor is probably the best way to try to get some of that spark back because without it, they just sort of see a partner as a parent and they don't really show up much as a partner. So it can create a really different dynamic between the two of them.
Yeah. And that would also help get rid of resentment too,
Hmm.
because
Hmm.
I know that comes up a lot. It's less so now, at least in my case for my husband and myself. But when we first had kids, he still was living his best life. And then
Yeah.
I was very much at home taking care of the kids and working and doing everything else.
Hmm.
And so then resentment was very much a third partner in our relationship. So
Hmm.
that is amazing advice in terms of like being your own person, but also chipping in so that it's less of an unequal split.
I have a chapter coming in my upcoming book, which is set to release, I think, in January.
Oh,
It's
exciting.
called "What Happened to My Sex Life," and one of the chapters is when you're a parent, not a partner, right? And it really speaks to that dynamic because it is so common, and a lot of male partners, as I said before, just really don't get it. They don't understand everything that their female partner is going through, and when they start to make that shift and they show up differently, their sex lives get way better,
Right.
way better.
Tip for everybody listening,
Yes.
not just so that you will do more chores. What happens if a female partner desexualizes herself? Like, is
Mhm.
that something that you see commonly? Does she then go back and look through the same sort of root situation, or is it something that's acquired along with this new identity?
Yeah, there can be a lot of reasons that a woman might desexualize herself. It can come from internalized misogyny and kind of an embedded idea of once I'm a mother, I'm a mother, and that's kind of the whole picture. Um, It can also come from very realistic asks and demands on her life. I know so many parents, primarily mothers, because mothers are often the primary parent, but they're just touched out, they're overstimulated. And it's not really a question of they've desexualized themselves, but they're so overstimulated in their body from breastfeeding and from having a child climb all over them and from being constantly physically demanded upon by their young ones that by the time the end of the day rolls around and their partner wants to get frisky, they're like, I don't have an ounce of anything even for me in my body, let alone sexual energy for you. So back off, right? So it's not always so much a desexualization as it is, I don't have anything to give anymore. And I think when partners are in that dilemma, what really can be beneficial is creating a designated space for mom to sort of return to herself and regularly and consistently. So every single day, taking time to herself, not to shower, not to go to Target to get more diapers, not to do errands, but to actually enjoy her own life and her own body and her own skin, right? Like that's a thing that a lot of mothers really um, get mired down in, is sort of just like the keeping it all together. And when their partners are not recognizing that and they're adding to the plate of demands, she might desexualize herself in a way to preserve whatever little energy she has left. And I find that when she does have time for herself and time to be a human, she has more vibrancy and more vitality back in her body. And guess what? Desire comes back.
So ultimately, we all just need more alone time so that we can have more meaningful together time.
Mm. I think that can be a great strategy. Yeah.
When it comes to swinging back to fertility,
Hmm.
how if you have become desexualized because you are constantly getting, internal ultrasounds, you are
Hmm.
sitting at the clinic, you are discussing, sex with professionals that have no interest in actual sex, like
Hmm.
myself, um, then do you is it a similar scenario? Like how do you is it the hobbies, like bringing back things that you enjoy? Like if it's not so much being touched out, but rather being too, I don't even know what the word would be, like too analyzed, because
Yeah.
the analyzing is so crazy. Like they know
It's
every aspect of what's going on in their body. And now with the advent of like Aura rings and
mm,
smartwatches and like ovulation strips, you can know everything and anything about your fertility
mhm,
without checking in with yourself.
mhm.
Um, so is there a similar strategy or
Yeah, I think that sort of like hyper medicalized or clinicalized relationship with your body can definitely sterilize your sexual or erotic vitality. There's not a lot of room for that if you are super in your head about what's going on in your body. Um, so bringing your body back into some somatically experienced or sensorially experienced moments of pleasure is really important, not just to increase desire, but to maintain a connection with your body that isn't um, this like performative relationship. Stay connected to other sensations that feel good. Get some candles that you like that smell really good, or splurge on the expensive lotion that you only buy once a year for yourself. And take your time to mindfully apply it to your skin and your feet. Get a new blanket that's fuzzy in all the ways you love. Like, really indulge your senses in ways that keep you connected to pleasure and enjoyment so you can like really savor that. Because we do, whenever something's going on medically, it's super easy to just float up into your head and get really disembodied. And that can be really hard, not only emotionally to kind of go through the experience that is your pregnancy journey, being so disembodied, but getting back into your body and reconnecting with it later can be more of a task. So yeah, I would say stay connected to it. Stay connected to movement, unless you're on some kind of movement restriction. Um, just stay connected to things that make your senses go, yay, and then like try to even nurture those little moments, even if you're not up for sex.
Dr. Kate, I love that. Yeah, I was thinking about that from the perspective of like getting outside and having, time to yourself to actually just enjoy, the weather if it's actually nice out, which right now in Toronto it is not, but it potentially is where you are. Tell us very quickly about your book before we pop off, because I feel like this is going to be an amazing resource for people.
Oh, thank you. Yeah, as I said, it's called What Happened to My Sex Life. And it's really a journey through the most common things that I hear in practice that are getting in the way of people having the sex life that they want. And I'll talk about lots of different examples, shame and how shame can really get in the way of our desire, sexual entitlement and that feeling of obligation, and how to move through that, sexual trauma, um, not really feeling connected to your partner anymore, not knowing if you're attracted to your partner anymore, that dynamic that we talked about in relationships where you feel like a parent and not a partner can really get in the way of folks having the sex they want. So there's a bunch of other topics in there, but it's really designed to be a quick guide into helping people sort out what could be going on, and once they identify something that could be right for their life and their story, giving them some answers on how to get that relationship with sex and desire back.
I said that this was going to be our parting thought, but now I have another question. Uh, do you ever have patients come in where they've never had a sexual relationship with themselves or with other people, and they just have no desire because they don't really think that it's important? And then
Sure.
maybe they feel like now they're missing out?
Absolutely. Yeah. I've worked with many folks who identify as asexual, and they really just don't identify sex as a priority for themselves. They may or may not participate in it with other people if it's important to them, but for them, they could sort of take it or leave it. And then I've worked with a lot of people who maybe didn't have sex for a long time in their lives because of trauma, or they were busy, or there's something else was going on, perhaps medically, and it wasn't a priority, and now all of a sudden it is, and they're wondering, well, what do I do? How do I get started, or how do I get back to it?
Right. And do you have resources for that individual?
Of course, yeah. I think a lot of it starts with asking questions, and being willing to be a little bit experimental, right? You might not know what you like, and that's okay. Um, I'll often provide lots of different resources, websites, or books and things that people can look at so they can start kind of trying on different fantasies, if you will, right? If this sounds interesting, well, here's a few videos to go watch about that. Why don't you do that and see if you feel anything? And let's talk about it later. So it's really about kind of just being willing to say, I don't know. And maybe I'll find out along the way. So creating an open space for curiosity is often the best time to, or the best way to sort of get yourself back into something that feels really fun.
Right. And I guess that could apply for anybody. Do you
Yeah.
do you have any other books or resources that you would say are like must check outs for people?
Well, if you haven't read anything by Emily Nagoski, I would immediately order all of her books. She's great. She has a book called Come As You Are that's sort of a quintessential read, all about female anatomy and desire and arousal. And it's probably the best sex ed book that I've ever read.
Right.
And then she has a new book out called Come Together, which is for couples and helps them address this sort of topic of mismatched desire, and how do you understand each other better, and is the sex that you're even having sex that you want, right? Because if you're not having great sex, it makes sense that you're not really interested in having more of it. So it's a beautiful blueprint for couples to get themselves back on track.
Right. Is she the expert who would identify that the clitoris is actually significantly longer and goes much further into the body than what was previously understood?
She might be, I don't know. I don't.
Right. Yeah, I just read about that. I don't remember where, but it was so fascinating that all anatomy books had it as just this like little,
Mm,
walnut or I guess peanut, I don't know, some type
Yeah,
of nut shaped part of our anatomy that just stopped there. But it actually goes much further up into our body, which
it does.
would explain much.
Yeah, I mean, the clitoris is the only organ that's designed just for pleasure, and this is what it looks like
Here
in turn.
we are. This is what we're talking about.
Yeah.
That's
So
what it
this is
looks like,
yeah, this is the head that
right?
we see coming out of the clitoral hood, and these are the legs and the bulbs. And these bulbs, when we're aroused, get bigger and expansive, and they put pressure along the vagina. So a lot of what's understood about pleasure is that the G spot and the A spot sort of live right here. And when the clitoris gets big and engorged with blood and desire, it sort of creates this awesome sensory experience vaginally.
Wow. I am obsessed with the fact that I have brought this up and now you just happen to have a little clitoris toy on your shelf. I guess it's a model, a scientific, useful model.
Look, we still have an orgasm gap that is really ridiculous. So 90, I think it's something like 96% of heterosexual men, in contrast to 65% of heterosexual women, have orgasms every time they have sex. And a big part of that disparate amount of pleasure is because we have not been taking the clitoris seriously. But if you'd hear one thing today, your clitoris is fucking amazing. So learn as much as you can about her.
That must be where we finish this interview. Your clitoris is fucking amazing. I'm obsessed. Thank you so much for coming. I really appreciate your time. Such a fan. I know so many of my listeners are going to be as well now, and we are all going to eagerly get your book when it comes out January 2025, which also just happens to be when I turn 40. So maybe that'll be my new awakening.
Amazing.
Be my present to myself.
Well, thank you again for having me on your show. This was so much fun.
It was a delight. Thank you so much.